Hello, everyone, and welcome to the latest episode of the Metabolism and Menopause podcast. My name is Stephanie, and I'm your host and CEO of VitalityOET. We are a women's nutrition, health, and fitness company that focuses predominantly on women's hormones, particularly as they start going through perimenopause and onwards. We know that you start experiencing so many changes in this time of your life, whether it be hot flashes, night sweats, irritability, brain fog, or that weight gain around the middle that seems to have come out of absolutely nowhere despite you not changing anything. So you go back to your tried and true methods of cutting calories, cutting carbs, doing a bunch of cardio, yet nothing seems to be working. In fact, you're putting in all this effort and it feels like you're moving backwards. But we know now that your body is inherently different than what it was to you prior to having these hormonal changes. So our mission here at Vitality is to help you really understand how your body changes in this time of your life so you can reach those health and fitness goals, feel in control and at home in your body again, live a life full of vitality, and really understand how to take care of this new body of yours. So today, what I want to talk about is a big trendy topic. It's everywhere. I've been avoiding doing it because I wanted to, have all the details and get a full understanding and talk to other health professionals. And that topic is, of course, Ozempic and GLP-1s. So let's face it, these drugs are here to stay. A lot of women are choosing to go on them. Weight loss drugs really aren't going anywhere. They are always going to be on the market because people are always wanting to lose weight, right? So I want to provide you with some of the pros and cons and give you some context and how to avoid negative side effects if you do choose to make that choice to go on Ozempic or another GLP-1, or if you're on them already, right? So I'm going to cover a little bit about what they do. I'm not going to get into the super nitty gritty stuff of it. Again, not a doctor. So I'm not giving you a specific medical advice. I am giving you the information that we have from studies, from research, from what we've done with working with clients who are on it or coming off of it. So we're going to give you a little bit of information on what they do, the cons of it, how to counteract those cons, and the negative side effects, because for some people, this is what they want to do, and that is totally fine. So if you do choose to go that route, there are just things to, be mindful of, be careful of. How can we set you up for success so that you don't see weight regain, which is very common in a lot of people, okay? So let's dive into this. I went to a conference, quite a bit ago now, where there was a doctor who was working with a nutrition coaching company as well. And they really dove into a lot. And I thought it was very interesting to hear from a doctor who is experienced in this, but also works in the nutrition coaching space, which I thought was phenomenal because you don't have a lot of those doctors who actually understand nutrition. So that was a very big pro, and I was very excited to, learn about this stuff a little bit more from someone who has more experience in this field and actually knows a bit more about what they're talking about, right? So she recommended that they be used in very specific places, right? Like some doctors, for example, will get paid for prescriptions. So you do have to remember that. That's not the case everywhere. Things change from country to country, province to province, state to state, right? And what she was saying was that it should be for individuals who are always hungry, okay? Who never feel full or satisfied, because it is an appetite suppressant, right? It will make you feel not hungry. You will feel more full. However, to improve hunger and satiety, we should be working on a lot of things first before going this route. So she said things that you want to make sure that you're doing are, having a high fiber diet, okay? Learning how to eat. So the order of food intake matters to help manage your cravings and things like that. Really prioritizing proteins. So getting a higher protein intake, really focusing on decreasing stress because we know that's going to skew your hunger cues as well. Eating enough food, getting enough sleep. So all the things that we talk about here on a regular basis. So it was very nice to hear that should be the first line of defense. The first option, what we need to prioritize, what we need to learn, which I thought was phenomenal. So it's crazy. It's like she was telling us things that we already knew. So that was a nice confirmation that we are on the right track and we're doing the right things and we're doing the things the research supports and all that kind of stuff. So it's just, it's always nice to kind of feel like you're getting a tap on the back sometimes, right? So can Ozempic and these drugs result in weight loss? Yes. But we also know that weight loss and fat loss are two very different things. And it's important to note that there are women that we've worked with that have taken Ozempic and it has not worked. So it does not work in all people. So you do have to be aware of that, right? Particularly for those who are already eating quite a low calorie diet, have done a lot of diet attempts. It doesn't seem to be as beneficial. You're not getting the same results as someone who is not in that space, right? And the why for this is there's a couple different reasons, right? Like your hormones can be out of alignment. Your metabolism is slow, so your body's not good at burning calories. We're not eating the right way, the right types of food. We're not really learning how to optimize our health first, right? She also said for best results, and she said this, which was awesome, work with a coach who understands metabolism and your hormones, how your body functions to get the best results from this drug, which I thought was amazing. Because again, not a lot of practitioners do that. So that was really nice to hear. So you can tell I was very happy with how this was going, this presentation. So let's tackle some of these cons that we see, particularly in women in perimenopause in the years after when they are on Ozempic, right? So when they're on these appetite suppressants, the GLP-1s, the fat loss pills, right? So the first issue that we're seeing is that a lot of women are struggling to get enough protein in. And we know protein is so important. I did a whole podcast on protein. I highly recommend you go listen to it. But during perimenopause and the years after, our body has a harder time actually utilizing protein. So we need more of it. We need a lot more protein. It's also important for regulating our blood sugar control, which we have a harder time when estrogen goes down. So when estrogen goes down, we struggle with our blood sugar control. If we aren't having enough protein in our diet, we're going to struggle even more. So protein can help you mitigate that loss from estrogen with that blood sugar control to really help you with that. Because we know if our blood sugar control isn't stable, it's harder to, lose weight. We have more cravings, we have more energy crashes, and protein can make such a huge difference in this area. The other thing too is protein helps keep us full for longer, to manage cravings, to improve energy throughout the day. And it's necessary, this is the big one, for maintaining muscle mass, which is a huge issue already in women in perimenopause in the years that move forward, right? We see this where women are like, I'm working out so hard, I'm challenging myself in the gym and I'm not getting the results. Like I don't look like I work out. And that's super frustrating. So when estrogen goes down, what we see is we have a harder time building and maintaining muscle mass because that is one of the roles that estrogen plays. So if we are taking an appetite suppressant drug like this and we're not hungry, it's even harder to get that protein in. So if we don't have enough protein, we can't build muscle. It's not possible. Okay. If we don't have enough calories, we can't build muscle. It's impossible. Okay. We need those things. So we need to also be making sure that we're working out in the appropriate way to maintain muscle mass. Muscle mass will also help you with blood sugar control. The more muscle mass you have, the more insulin sensitive you are. So you aren't going to have as high of an A1C. You're going to have better blood sugar control, which we know is a huge issue. So if we are, on this appetite suppressant, protein is very filling. So it is very, very, very hard to get your protein in. So really focusing on prioritizing protein is going to be a huge part of this because it's already an issue we struggle with in perimenopause and menopause. And then if we're not hungry and it's filling and we're on Ozempic, it can make it more challenging, right? So that's the first negative that we see. The second one is your skin and looking like you're aging, which a lot of people don't realize. So you can actually look older because of the lack of protein and fat making your skin less elastic. So you look older, Skin almost feels like it's sagging a bit. And when you're on Ozempic, and if you're one of those people that does experience quick weight loss off of it, you don't really have a time to adapt to that loss. So your skin doesn't have time to slowly tighten up. So then you'll see that your skin just sags. It's kind of crepey. You might have more wrinkles. And this is all about energy allocation, right? If we're in a very low calorie state, you're going to see that your body starts prioritizing certain things, right? To make sure it can still function. Hormones is one of those things that'll tank. Also, your body doesn't care about having nice hair, nice skin, being elastic. So that's something else you have to be aware of as a consequence that can appear from being on this drug. The next one is nutrient deficiency risk. So when we are on this appetite suppressant type drug and it's harder to get your calories in, you can see that it's also harder to get enough nutrients in because you aren't eating as much, and you can actually become malnourished. We've seen this with some people where we really, really, really have to prioritize certain foods, or maybe we have to supplement to get the right nutrients in. It's also a lot harder to get those whole foods in your diet regularly when you're on Ozempic. And this is because those foods are very filling, right? If we're having whole grains and oatmeal and fruits and veggies and potatoes and, we're having lean cuts of meat, it's hard to get enough nutrients in because those things are already filling on their own. So it's harder to get nutrients because it's slowing down your digestion. It's an appetite suppressant. You're not as hungry. So being aware of that, again, also incredibly important. And these are things that you should be addressing before you go onto a weight loss drug, because these are the things that are going to help you as well, right? I mentioned muscle a little bit before when I was talking about protein. So that's number 4, muscle loss. So like I said, we want to build and maintain as much muscle during perimenopause and menopause. Muscle is so important. I cannot stress this enough. It not only helps you look good, right? You look fit, you look toned, because if you lose weight and you have no muscle underneath, you don't look like the pictures that you want to look like, right? So muscle helps improve our insulin resistance. I already talked about that. A low muscle mass is actually associated with a lot of negative health outcomes like diabetes and cardiovascular disease. Muscle helps keep our metabolism high. The more muscle that you have on your body, the more calories that you burn at rest, making it easier to lose weight. Or it makes it harder for you to gain weight because your body is good at burning calories the more muscle that you have. So we already mentioned it's hard to build and maintain muscle mass when estrogen goes down. If we're struggling to get our protein in, if we're not getting enough calories, we are at risk of seeing more muscle loss. And this is an issue too, because we don't realize with low muscle mass, we have longer hospital stays. We have an increased risk of surgical complications, increased risk of all-cause mortality just from having less muscle mass. So maintaining muscle isn't just a thing to help you look good. It's actually so crucial for your health. So we need to make sure you're working out in the right way, that you're maintaining muscle mass. Because if all you're doing is cardio, you're going to see muscle loss even more. Lack of appetite. Obviously, if you have no appetite, you can imagine how hard it is to eat enough food to support healthy hormone production, buffer stress, get enough vitamins, minerals, fiber, etc. All those things to help keep things functioning. So if we're not getting enough calories in, and I talk about this all the time, right? We'll see our stress levels go up. Our body is under more stress. We see the muscle loss. We don't have enough to support healthy hormone pathways. All of these things that help keep our body functioning properly. And then when you just go off of the drug, all these things have kept going underneath. And then we can see that rapid weight gain afterwards, which we don't want. The other thing too, that's an issue with Ozempic and things like that, is that no one really talks about the education about stress management, recovery, sleep, because the lack of calories and from the lack of appetite is a huge stress on your body. So we really need to focus on actively taking self-care practices to help buffer that stress response, because we can't rely on nutrition to do that for us. So like I mentioned in past podcasts, and I talk about this a lot, but when our stress is high, from under eating, over exercising, not sleeping enough, not doing enough self-care, fasting, skipping meals, having caffeine on an empty stomach, being go, 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 work deadlines and family relationships, and your kids driving you crazy, and your pets are doing all kinds of things, and you have financial stress and work stress and all these things. Before, you could handle a 9 out of 10. Now we can only handle a 5 out of 10 because our estrogen levels are lower, and that helps buffer that stress response. And now we're eating even less because we're on Ozempic, right? So now we're seeing this huge stress response, and typically how we buffer stress is by making sure we're eating enough and recovering well. But a lot of us will go on Ozempic and not change anything. We won't change our self-care. We won't focus on improving sleep. We don't change the way that we're working out. So we have this huge stress response that is kind of being almost masked a little bit. And then when you come off, it's like it hits your body like a truck, right? So we need to make sure that you are sleeping enough, that you are focusing on your recovery and self-care, because when we're in that high stress state, our muscle mass keeps getting broken down and broken down and broken down because our body wants to use that for energy. So we need to really be aware and focus on these things if you are on Ozempic. The next issue is that it doesn't address food quality, right? If we don't focus and work on food quality and pairings before you hop on this drug, when you come back off the medication and your appetite comes back, it's the perfect storm for weight regain, right? Because you're going to go back to eating the exact same. And you have to change things. You can't go back to what got you to where you were. We need to change things. So focusing on food quality, food pairings, order of food, are you having most of your proteins and veggies first before dipping into your carbs? Are we drinking a lot of our calories? Are we, opting for more processed foods than whole foods? All of these things are going to make implications for how successful you will be coming off of it. So you need to learn these things before, because it's really hard to do these things when you are on this kind of drug, right? The next one is slower metabolism and hormone issues. So with a calorie, so we have some women on this drug in our program, and they're eating 500 to 900 calories a day. It's really hard, and we try to bump them up more, right? But you lose a lot of muscle mass during that process, right? Your hormones are going to start changing. Metabolism is going to slow down, so your body's not good at burning calories. It's going to lead to issues when you're done. So being able to be proactive and learn how your body functions first and what your body needs and how to support that better before hopping on a drug like this, again, is very important in being proactive, because we don't want to lose weight and gain it back again. That's not why you guys are listening to this podcast. You want to lose the weight, you want to keep it off, and you don't want to feel like you can't enjoy food. So how does doing this and basically just being on a really low calorie diet and then just going back to quote unquote normal afterwards, how's that going to benefit you? So you really have to think about that and understand those things before you go on it. And the last thing is, there's rarely an exit plan. They just give you the drug for 3 months or whatever the plan is, right? Because that's currently what the standard is. And then you stop. And then what? What's the plan afterwards? How do we ensure this weight doesn't come back on? That's really hard. So you need an exit plan. You need an exit plan for any kind of diet, but especially something that's as low calorie as this. So because I know that GLP-1s are not going anywhere, right? They are here to stay. I have come up with a list on really how to counteract all those negative side effects and avoid that weight regain, right? But we also have a protocol that we like to use with clients on Ozempic to help them lose weight while maintaining muscle mass as best as possible, keeping their metabolism up, keeping their hormones happy, and feeling good. Okay, so considerations if you are going to do this solo is, first, consider reverse dieting, getting your metabolism hormones in a better position first, so that you're going into it with the best chances to avoid weight regain as possible. Okay. 2, resistance training. This is honestly a non-negotiable. If you are not resistance training, and I mean you are focusing on getting stronger every single week. Okay. We aren't just doing workouts with 2-pound weights. Like you need to challenge your body to get stronger every single week. You're following a plan. You're working out regularly, maybe 2 to 3 days a week, full body. We are getting stronger. We are lifting in the lower rep range. We are taking 2 to 3 minute breaks in between. We are focusing on maximizing muscle mass as best as possible and then continuing with that routine when you're going on the drug. Okay. This is huge because otherwise you are losing so much muscle. You need to do something to actually send that muscle building signal to your body. Cardio does not signal muscle building. Using the same weights and the same workout routine for months, that's not going to send a muscle signal. If you are never changing the tempo, if you are never like really challenging yourself, those things are not going to build muscle. And when I say challenge, I don't mean hard. Anyone can make a workout feel hard, right? You can sweat, you can add in some jumping, some running, some burpees. Anyone can make a workout feel harder, right? To make it feel sweatier, to have your heart rate up, but that does not mean that it is effective. Okay? So you need to focus on finding a program and following it and being dedicated to focus on building and maintaining muscle mass. And no, you will not look like the Hulk. It is so hard to put on muscle, like so hard. It's not going to happen one day you just wake up, you're like, holy crap, I'm super muscular. The best part is once you get to a place where you want to be, then you just stop, right? You can decrease your intensity. You don't have to push as hard to maintain. It's something like you can decrease your workouts by 1 to 2/3. So you don't have to do quite as much volume or quite as much stress on your body to see these changes. So you're never just going to wake up one day and be like, oh my gosh, it's too muscly. That'll never happen, I promise you, okay? The next thing is, in order to continue to build that muscle and have a good workout program, you also have to eat enough carbs and protein. You cannot build muscle if you're not eating enough calories, if you're not having enough carbs, if you're not having enough protein. Will not happen, okay? Like scientifically, this is debunked. You cannot lose fat and build muscle at the same time. Especially if you are on a drug like Ozempic, you will not build muscle because you are not eating enough food. So making sure that you are prioritizing this before you go into that is super important. And like getting yourself up to that place and giving yourself time to put on muscle mass. Okay? Because otherwise you're going to lose weight. You're just going to have a higher body fat percentage because like you're losing muscle as well. You're not going to look the way that you want and you're going to come off of it. And then, everything kind of goes to crap. You need to be proactive in planning this. Okay. I also consider getting your hormones tested first so you can see changes in levels over time. Try and optimize those hormones before going on Ozempic if you can for better success rate. But also like getting tested throughout is really important so you can see how your body's responding because there hasn't been enough work on this and we know how important hormones are and how we function and how we feel. So this is something that I would really prioritize and especially get done and see if we can optimize those levels naturally first through proper lifestyle, nutrition, activity before then diving into this to make your success rate that much better, right? And then of course, prioritizing 80% whole foods. Because if you're not learning how to do that now, you're sure as heck not going to do it when you're on the drug, right? So really prioritize those whole foods. As I mentioned before, we've come up with a protocol that is great for working with clients on GLP-1s and Ozempic to really help counteract those negative effects on muscle loss, your metabolism, your hormones, your stress pathways. And we're always happy to help you regardless of what medications you're on, right? We are here to support you and help you based on the decisions that you make and set you up for success because the last thing I ever want to see is women lose weight and then gain it back again. We're not doing this yo-yo dieting cycle anymore. We are doing things, doing them the right way, learning how to support our bodies, and then learning how to maintain results. Having an exit plan is so important. If you have any questions whatsoever, please message me. I'm always happy to help, Always happy to discuss. If you want to get your calories calculated for free, you can book a consultation call or message me, whatever you like. We are here to support you in whatever way that we can. Have a great rest of your day, and I'll talk to you soon. Bye.